Hello, Wayne County Community College students. We're on chapter 42 in our text, and we're going to learn about the urinary system, the kidneys or the renal system, however you want to call it. It's chapter 42. Remember, for this exam, it's going to include the urinary system along with chapter 44, which is the acid-base system. I just combined those two because the kidneys do a lot of that, keeping our acid-base balance pretty good. So let's get started with this. Let's look at the urinary system. Kidneys. Kidneys process blood and form urine as waste to be excreted. The shape of the kidneys is they resemble a lima bean. That is, they're oval with a medial indentation, which we'll talk about in a minute. The size on average is about 4 inches by 2.5 inches by about 1 inch, so they're not that big, they're pretty small. And the left kidney is slightly larger than the right kidney. The location, both kidneys lie in a retroperitoneal position. So that means they're in the back, retroperitoneal, retro meaning behind. They're posterior to the parietal peritoneum and against the posterior wall of the abdomen. They're on either side of the vertebral column and extend from about T12, thoracic 12, to about L3, lumbar 3. So the third lumbar is their bottom point, and their upper point is about a 12th thoracic vertebra, right? The right kidney is slightly lower than the left kidney because the liver takes up a lot of space above the right kidney. So the right kidney is a little bit lower because the liver is here and it's kind of pushing it out, even though I'm telling you the kidneys are back here. Position. Each kidney is surrounded by a thick cushion of fat, and that helps secure them and hold them in place. We also have connective tissue or renal fascia that anchors the kidneys to maintain their normal position. The hilum is a concave notch on the medial aspect of each kidney. Structures such as the blood vessels, the ureter, etc., will enter and exit through this notch. Now we said the kidneys have a medial indentation. That medial indentation is the hilum. So if you can see the shape of this kidney, I'm exaggerating it a bit there. This area here will be called the hilum. That's the medial indentation, and if you know what a lima bean looks like, this is the pretty much the shape. Or, I'd have to think about how kidney beans look, but this is the shape. It looks like a lima bean. All right, let's go over here and look at the structure of the kidney. We have the renal cortex. The renal cortex, it provides the outer region of the kidney. The renal medulla is the inner region. So when we see cortex, we're going to think about the outer part of the kidney or the outer edge of the kidney. And when we see medulla, you're going to think about the inner part. And not just the kidney, but this is the way we talk about organs anyway. The medulla is the inner portion. The cortex or the cortical region is the most outer portion. Sometimes you may see this word as cortical, but don't get all freaked out. Just take the root, C-O-R-T, and you'll know that they're talking about the cortex. Or you may see the medulla as a medullary. Don't get freaked out just because they added an R-Y to medulla. Know that that's the inner part of any organ that we're talking about. In this case, it's the kidney, so we have the outer region and the inner region, the cortex and the medulla, respectively. Let's look at the renal pyramids. Renal pyramids are triangular wedges that make up the medulla. The base of the pyramids faces outwards. Now I'm going to draw this and we're going to go through this to see if all these definitions hold true to what we are discussing. The papilla is a narrow apex, and it faces inward toward the hilum. So you got some parts facing outward, and you have a part that faces more inward towards the hilum. Renal columns are the cortex. Here we are with cortical, so you know that's the cortex. This is cortical tissue that goes up in between the medullary pyramids. The calyx, this is where the papilla, which we just learned is the point of the pyramid, empties. I need you to remember that this will indeed be the beginning of the plumbing system. The beginning, and you underline that, this is the beginning of the plumbing system. So drip by drip, as urine is formed, it will start to go into these calyces, right? And the calyces, I will discuss here, as they coalesce, they become the renal pelvis. And these calyces, so you can see that this is plural for calyx. Calyx is singular, calyces is plural. These are minor and major calyces that join together. They're going to coalesce to form a large collection reservoir. That large collection reservoir is known as the renal pelvis. The ureter is after the renal pelvis narrows. That becomes the narrowed renal pelvis, and now that will indeed exit the hilum. And the hilum, of course, is this indented portion of the kidney. So I'm going to keep this part here just as a guide for me. I'm going to erase this other part where we just introduce the kidney, and let's just see if we can put these words into a drawing that we can understand. So let's draw a nice macroscopic view of the kidney. The same thing that you would dissecting, if we were to dissect the kidney, these are some of the structures you would be able to see. So let's just draw a macroscopic view of the kidney here. This is what you can see with the naked eye. Macro, large view of the kidney. And let me just put some medullary or some pyramids in here. And we know that the base of the pyramids face outward, which we call the cortical region, and we know that the points of the papilla point towards the hilum. So let's just look at this for a minute and see how this goes. So the renal cortex is the outer region. So that would be all along here. This is the cortex all around here. And then the medulla, we said, is the inner region. So this would be considered the medulla inside here. Renal pyramids are these triangular wedges. They look like pyramids, right? And they make up the medulla. Sometimes you could call these medullary pyramids, or you could just call it the medulla, or you could just call them the renal pyramids. Either way, you will know that the pyramids are in the medulla. And the base of the pyramids faces outward. So this is the base here. And yes, they do face outwards towards the cortex, or the cortical region. The papilla, these are the narrow apices, so the tips here and here and here, they face inward towards the hilum. Are you following me? The renal columns, here are the columns in between here and here. Renal columns, that's the cortical tissue has pushed down in between these pyramids. And the cortical tissue, as it pushes down in between here, forms, it looks like a column. You can see this looks like a column in between the pyramids. So that's what this one is called. The calyx. Calyces are interesting in that this is where the papilla, the point of the pyramid, empty. So the point of each of these pyramids are going to empty into the papilla. Now let me just, I do this kind of deep. Let me just make it a little shallow. So I want to do something here. I want to draw these little cup-like things like that. That is going to be the minor calyx. Drip by drip. And as these minor calyx kind of come together, they form a major calyx. The major and minor calyx form what we call the renal pelvis. And the renal pelvis is right here. This indentation is the hilum, that is true. But if I ask what is this area, that's the renal pelvis. The indentation itself is the hilum. Once you get to the renal pelvis, that's where these calyces, these are the minor calyxes here, minor calyx, they coalesce and make a major calyx. And then the major and the minor calyx form the renal pelvis. The renal pelvis will now narrow, let's make it narrow, as it exits through this hilum. And this becomes the ureter. The ureter is a narrowed renal pelvis that exits the hilum. Is that clear? So we went through all of these words to give a picture, and all the definitions should fit this picture. Cortical region is the outside, known as the cortex. The medullary region, the medulla, is on the inside. Drip by drip, and we'll get to the drip part. Right now we just need to understand this macroscopic view of the kidney, because what I need you to understand is that there are going to be two views of the kidney, a macroscopic view and a microscopic view. The microscopic view is what we need in order to really make the urine. And drip by drip, it will go into, from what is out here, going deep in here, and make the urine from this papilla into the minor calyces, collecting here in the renal pelvis, and then coming on out of the ureter to land into the bladder, where of course the urinary bladder will store the urine until you are able to urinate properly, like a toilet. So this is the first part of the kidney, which is a macroscopic view. Now the next part is we're going to go over the blood vessels of the kidney, and I'm going to write those up, and then we'll come right back and look at what I've written. Okay, so let's pick up with the blood vessels of the kidney. Blood vessels of the kidney. Every minute, about a liter of blood flows through the kidneys. Every minute, about a liter of blood flows through the kidneys. About 20%, so that's about a fifth, of all blood pumped by our heart per minute goes to the kidneys. So this is why the kidneys, you have to make sure that you protect the kidneys, so that you too, don't end up on a lot of things that we see in our city, a lot of dialysis. And we'll talk about, I'm going to mention a little bit about that a little later, because I want you to see the importance of the kidneys and how dynamic it is. So let's look at this blood flow. And I know it looks like a lot, but I'm going to break it down into algorithm, and I'm only going to want you to know maybe 4 of the vessels. So let's just look at the flow now. So a branch from the abdominal aorta, remember the aorta when we first learned about the heart? Well, it looks kind of like a candy cane. It curves down to give blood to all tissues of the body. Well, as it curves down from the left ventricle coming on down through the diaphragm and into the abdomen. This is the abdominal aorta. Kidneys sit right there, right off of the aorta. You have the renal artery. So the renal artery brings blood into each kidney. Remember, arteries takes blood away from the heart. So now they're going to organs. As the artery approaches, so as this renal artery approaches the kidney, it divides into segmental arteries, which divide into lobar arteries. It's going to be a lot of divisions. It's not going to be this big old renal artery bringing blood straight into the kidney from the abdominal aorta. You remember how large the aorta is. That would kind of blow out these little organs. So there's going to be a sequence of divisions to get the blood to kind of slow down and then infiltrate the kidneys. So as you go from, as an artery approaches the kidney, it divides into segmental arteries, which divide into lobar arteries. Going to be some more branching, branch more to form interlobar arteries that extend towards the cortex, towards the outer regions of the kidney, then arch over the bases of the pyramids to form arcuate arteries. So you know this arch will form over the base of the pyramid, so hence the word arcuate, arcuate arteries. Finally, the artery is going to be penetrating the cortex as the interlobular. Now I want you to see that interlobular is different than interlobar. You can see the spelling is different. This interlobular artery is something I want you to put an asterisk by and remember, interlobular arteries. Branches of the interlobular arteries are known as the afferent arteries, branch into a grouping of several capillaries known as the glomerulus. The glomerulus is actually a tuft of capillaries. It looks like a ball of like hair, whatever, and it's just a tuft of capillaries. That's what the glomerulus is. Blood leaving the glomerular capillaries will flow into the efferent arterioles at this point. So you got afferent arterioles and efferent arterioles. As the blood comes to the efferent arterioles and then into the peritubular capillaries, the capillary blood then begins to drain in a reverse direction to ultimately dump into the inferior vena cava. So you have blood coming towards, away from the heart to fill all the tissues and the organs and the kidney, etc. Now it's got to reverse as the blood goes to the inferior vena cava. It's going to reverse and now go through a venous system to go back towards the heart. So the venous blood goes towards the heart. The arterial blood goes away from the heart. You can remember arterial for away, A and A. So we're going to look at this. These are the things that I want you to keep in mind, though. It would be, these are the four that you need to know for sure. We'll start here with the interlobular artery. You put an asterisk there. Afferent arterioles, glomerulus, of course, which is a tuft of capillaries, and then the efferent arterioles. Interestingly enough, if you recall when we learned about the usual way that our blood flows, if you recall, it is artery, arterial, capillary, venual to veins. But here you can see that it's something a little different going on in that this efferent arteriole is between two capillary beds. This efferent arteriole is between the glomerular capillaries and the peritubular capillaries, which is very unusual. So the kidney has its own unique blood flow, and we will see that when blood comes towards the kidneys, it's coming in towards the kidneys through the afferent arterioles. As blood exits the kidney, it's going to leave the kidney through this efferent. So we'll think of efferent, E for exit. These efferent arterioles will be the way that the blood will leave the kidney to eventually go into the inferior vena cava to start the system all over again, going back through the heart. We're going to look at the peritubular capillaries, peri meaning around, tubule. The kidneys are a system of tubes, so around the kidney, these peritubular capillaries are going to be very important in getting substances in or out of the urinary system. So we're going to look at these few blood vessels and really get to know what they are. Another point I wanted to mention is that the peritubular capillaries are down in the bottom parts, like in the medulla. I'm going to show you this part in a minute, which is known as the vasa recta. The vasa recta. The vasa recta is a portion of the peritubular capillary that loops down into the medulla and then back to supply the loop of Henle and the collecting ducts. We're going to look at that system in just a minute, but what I want to do first is put this in an algorithm so you can kind of see the flow of blood, and I kind of want to go over how this system is pretty important to how your kidneys will function. So let's get this erased because it's the only space I have, and we will put this in a way like a flow chart, so to speak, or an algorithm, so we keep it in sequence. It's really only 4 arteries on here that I'm really interested in knowing, or arterioles. You know, if it's coming from the aorta, it's an artery or an arteriole. If it's coming from the aorta, it's an artery or an arteriole. So let's look at the aorta. It's going to go to the renal artery. And I'll just use the A for short, because everything coming off of an aorta is going to be an artery or an arteriole. And then you have segmental. To lobar, to enter lobar, to arcuate, to enter lobular. If you recall, this is the one I asked you guys to put an asterisk by, so I'll do it here. To afferent. These are going to be arterioles now. Notice the change. Put an asterisk by that one too, because I asked you guys to remember that one. To the glomerulus. Remember that one, that is glomerulus. So we're going to take it on down. Since I ran out of space here, we'll pick it up over here. Now remember, the glomerulus is a tuft of capillaries, right? And we're going to go from there to, let's say, to here. I have to hold this board. To efferent. arterioles to the peritubular capillaries. Okay? So these four vessels are what I want you to focus on: intralobular, afferent arterioles, glomerulus, efferent arterioles, and you can throw peritubular in there too, but just the four that really are with the asterisk. Point is, I want you to see that the efferent arteriole is sandwiched between two beds of capillaries. So this, remember, glomerulus is our capillaries. Right? So sandwiched between these two beds of capillaries is the efferent arteriole. The efferent arteriole is the way blood will start to leave the kidney, to exit the kidney. The afferent arteriole is the method in which blood will come into the kidney. There are going to be some other things I'm going to mention about the afferent arteriole, so please remember it. It's a very, very important measure of how we regulate our fluid. The afferent arteriole is always looking and detecting how blood is coming into the kidney, so keep that in mind. And these arterioles are very, very important. Now, when it gets to the peritubular capillaries, it eventually goes to the inferior vena cava, and then it reverses and goes back the other way. But now these aren't arteries; these are going to be called. Most of them will be called. They'll be called veins, right? Back from the inferior vena cava, just going in the backwards way. I think you will see that through as it goes through. You can see that in your text. Peritubular capillary goes to the intralobular veins, to the arcuate vein, to the interlobar vein, lobar vein, segmental vein, renal vein, and the inferior vena cava. So that it'll just go backwards like that. So now we know how blood flows through the kidneys. Next time we'll lecture on how urine travels. Okay. Before we go though, I wanted to show you the glomerulus, not the glomerulus, but the nephron. I want to show you a macroscopic and microscopic point of view of the kidney. This was something that that is the big picture of it, and I want you to just get this. So hold on, we'll get to this now. As long as you have this flow in mind, right? It's the same thing I wrote on the board, but I just put it in a flow chart so you can get this. But let me compare two things for you so that you can really understand the big picture of this and how small these arteries and arterioles become after they leave the aorta. And then you'll see how we start to make urine. And that way, that will be a good segue into discussing how urine travels, okay, or how urine flows. So let's just look at something real briefly. I want to draw the glomerulus here, and then the glomerulus, like this tuft of capillaries we talked about, I need you to realize that it sits in something known as the Bowman's capsule. All right. I'm just drawing this like this. I'll probably do better if I didn't look, because I know this. Draw it like that. Whew. All right. So let let me get rid of these words here, and then we can look at this macroscopic view. So this is the nephron. Go to a kidney specialist, it's a nephrologist, and this is microscopic view. So this is a microscopic view. This is very small. You cannot see this with the naked eye like we did when we looked at the kidney as a whole. That was like I guess that was like a cut, a sagittal cut of the kidney. We looked at it with a macroscopic view. But here is a microscopic view. And you can look at this, and this is, I'm going to show you where this fits into the macroscopic view. So let's have this glomerulus here. I'll just start labeling everything. This is the glomerulus. And what is a glomerulus? Remember, it's a tuft of capillaries. The glomerulus sits in this, which is the Bowman's capsule. And then the Bowman's capsule comes out and it becomes here. This is close to Bowman's capsule, so we call this proximal. This is proximal convoluted tubule. It's just a fancy word for tube. It's proximal to Bowman's capsule. It's close to Bowman's capsule, therefore it's the proximal convoluted tubule. This little hairpin thing here, this is called the loop of Henle. Guess somebody's name is Henle. We'll call it the loop of Henle. Over here, since this is proximal, and that is also a convoluted tubule, but it's further away from Bowman's capsule, it's called the distal convoluted tubule. So this is the distal convoluted tubule. Then here, coming down here, is the collecting duct. Or you could call it collecting tubule or collecting duct. Collecting tubule, collecting duct, correct. Now, the interesting thing I want you to know here is that right here, that little cup we drew before, this is a calyx. Okay? And I told you drip by drip. So urine is made drip by drip, drop by drop. After it gets filtered through this glomerulus, it starts coming on through these tubes. We'll get into more detail about what stays in the tube and what leaves the tube later, but whatever does stay in this tube will eventually end up in the toilet. So that is the goal, the toilet, right? If it stays in the tube, you secrete, you're going to excrete. So it stays in the tube, it's going to go into the toilet. Now, the other thing I want to point out here are these little arterioles. So I'm just going to make this one the afferent tubule. And if that's the afferent tubule, this will be the efferent tubule. Right? So efferent is what it means exit. So this is where the blood will come out and then it will end up around all these peritubular capillaries. Peritubular. Let me see if I can make the efferent to now leave and become, I don't know if you can see that green, but that is, this is going to be peri, because it's going around peritubular capillary. Oops. Probably a much better depiction in the text, but from the efferent tubule, you do get peritubular capillary. It goes all around the tubes. That's going to be important later when I explain when we get to the physiology part. Right now, I just need you to know the anatomy of where everything is in this nephron, or this microscopic view of the kidney. Let's draw a macroscopic view. I can squeeze it in here, and we'll see how this all fits in. So let's just draw what we had before. Put some renal pyramids in here. Remember, this is the cortical region or the cortex. This is the medullary region or the medulla, right? This is the hilum, also the area where things enter and exit. So the renal artery, renal vein will enter and exit through here, as well as the ureter will exit through here, okay? Now, I need you to know that this is microscopic and this is macroscopic. So we can see this part with the naked eye. This is the way the kidney looks. This nephron, and you're going to have a bajillion of them, and we'll talk about the exact number later, but you're going to have a lot of them. They fit in here. The job really of your kidney is this. And this is the thing, this nephron is what you don't want to damage. They're housed in the kidneys. And let me show you how. So, point being made here is that I'm going to draw, let's just draw one of them. Here's the glomerulus, boneless capsule, convoluted tubule, coming down, and boom. I don't know if you can see that. I'm going to make this a little bit exaggerated to make sure you can see that. All right. Boneless capsule, proximal convoluted tubule, loop of Henle, distal convoluted tubule, collecting duct going all the way down here. And you must remember, we have our calyces here, right? These are the bases here. And drip by drip, they will collect into the minor calyx and then into the major calyx and come on out through the ureter. As the renal pelvis narrows, it becomes the ureter. We have a lot of these all around. Point I want to make here is what is in the cortical region. What is in the cortical region? Say that's an imaginary line. Everything above this line is the cortex. Everything below this line is the medulla. Can you see in the cortex, the cortical region, that we have the glomerulus here, and the convoluted tubules here, and then remember, that's the cortical region, right? So above, this is the cortex. You can see here, when it's transposed, that we have the glomerulus, the boneless capsule, and the convoluted tubules here. Down in the medulla, here's below the line in the medulla. Here is in the medulla. We have the loop of Henle. Can you see the loop of Henle here? That is in the medulla, correct? And then you have the rest of the collecting duct is here in the medulla. The rest of the collecting duct is in the medulla. You see this calyx here? That's the calyx right here. So there are a lot of these, and these nephrons are the things you don't want to damage. This is why I try to implore you guys to drink water, and water only. Not juice, not pop, not coffee, and maybe occasionally tea, but mainly water. Water should be your beverage of choice. This helps keep your kidneys functioning properly. Significantly decrease your salt, because we saw, well, we won't fit it on here, but if I draw the aorta, and the two renal arteries coming out here for the kidney here and the kidney there. Can you imagine the force of the blood coming out of the aortic, abdominal aorta, shooting into these renal arteries and then going into the kidneys? When the pressure is higher, the kidneys feel that. So you want to keep your blood pressure on the lower side so you don't damage your kidneys. If you take antihypertensive medication, blood pressure medication, don't play with that. Take the medication, decrease your salt, and drink your more water. And do not try to fool around with these other drinks, especially juices. Don't give that to your children, because eventually they'll get addicted, of course, to the sugar, but also it's a lot of other salts and sugars in these things that will definitely affect your kidneys. So, two main reasons people are on dialysis is one, salt. The other one, that's salt that causes the hypertension. And the other reason is sugar that causes the diabetes, and diabetes will mess up those little arteries that we talked about, segmental, the arcuate arteries, interlobar, interlobular, and mess up those arteries, because that's what diabetes is. It's a vascular disease. So here we gotta know what's going on. I need you to superimpose this microscopic nephron, and it's a lot of them in here that are working day and night to keep these kidneys healthy. You can help that by not drinking juices, pops, or soda, whatever region you're from, and things like that, and don't give that to your children. Water is the key, and that will help them. So this, I just wanted to make sure that you understood that. One other thing before we go, this area here, where it's the bonus capsule here and the glomerulus here, this is called the renal corpuscle. Renal corpuscle, where the bonus capsule and the glomerulus are together. That is called the renal corpuscle. You'll see all of this in your text, but it's a lot easier when you hear it, from a lecturer, and then when you're reading, you go, oh yeah, so you'll get it. I'm trying to see if there's anything else that I missed out on. I do want you to know that the majority of the nephron is in the cortical region. So the majority of the nephron is in the cortical region. I would say that's about 85%. Your book may say something in 15%. Just the loop of Henle and the remaining of the collecting duct is in the medulla region. So does that add up to 100? All right. So that's really it for this one. I think the next time we meet, I will be going over the rest of the anatomy. Now that we kind of got have a gist of what the kidney is like and how the nephron fits into the kidney. All right, we'll take it up with the anatomy next. All right, so here we are back, and we're going to continue with the anatomy. These are ureters. The ureters, or ureter. The ureters, there should be two of them, are approximately 34 centimeters long. That's about a foot, 13 inches or so. There are two tubes that take the urine from the kidney to the bladder, and it enters the bladder at lateral angles of the trigone. This is a triangular shaped floor. The ends of the ureters, after inserting into the bladder, serve as valves to prevent urine backflow. So once the ureters enter into the bladder, they prevent the urine from going back up into the kidneys. That insertion itself acts as a valve to prevent backflow of urine. The ureters are composed of 3 layers of tissue. Of course, you have the mucus lining that to just really stop to help with resistance and decreased friction. The muscular layer, of course, this is smooth muscle that pushes urine towards the bladder. The rate and the strength of this movement, which is peristalsis, increases with urine volume. So the more urine you have, the faster and more urine will go towards the bladder. And you have the fibrous outer layer, and of course that's for protection. So just draw the kidneys this way. And let's have the ureters exiting the hilum. It's kind of wide, right? And then this is going to be the bladder, and I'm just going to have it enter here, and then we'll have this one here. And you can see that this is the trigone that's formed in the floor of the bladder. So the kidneys here, ureters here and here, the bladder, and then the urethra here. This is a short urethra, so we'll just say this is in female, because the female's urethra is shorter. We'll talk about that in just a minute. So those are the ureters, right? Let's talk about the urinary bladder. Urinary bladder here. This is a muscular collapsible pouch. It's located directly behind the symphysis pubis. Remember that bone that you learned about? I think that was in 240. There's the symphysis pubis. It goes right in front of the bladder, and it's in front of the rectum. So this is anterior. The bladder is anterior to the rectum. In women, it's anterior to the vagina and the uterus. So in women, the bladder is anterior in front of the vagina and the uterus. In men, the bladder sits directly on top of the prostate gland. We'll talk about the importance of that in a minute. It's composed of smooth muscle, smooth detrusor muscle. It's a network of circular, longitudinal, and oblique muscle. Where did you learn about that from? Circular, longitudinal, and oblique muscle. We learned about that when we talked about the stomach, if you recall. Those three types of muscle were indeed located in the stomach, and they are here too in the urinary bladder. It's lined with a type of mucus transitional epithelium. You will see transitional epithelium only in the urinary system, specifically here in the bladder, because that epithelium is allowed to transition from when it's full with urine, it'll be really full and puffed out, right? Distended is the word. But then after you urinate, the pouch, the urinary bladder, will collapse. So it transitions from being full and distended to, after urinating, it collapses. So that transition is a special kind of epithelium known as transitional epithelium. Okay. It has folds in here. Here again, familiar with the stomach, if you recall, the rugae, R-U-G-A-E, is also found here in this bladder, in this urinary bladder. That rugae, those folds, allow for great extension, right? There's three openings, two from the ureters here, and one for the urethra here. That's a little short urethra. Two major functions of the urinary bladder. One is there to serve as a reservoir for urine before it exits the body. And two, it's aided by the urethra to expel urine from the body. So it holds urine and it can expel urine, aided by the urethra to get the urine out. When we have urine in here, in this urinary bladder, this is considered as waste. You don't want to do anything else with the urine but put it in the toilet. I've heard some students asking me if they should take a baby's diaper and put it on their pimples and do all this stuff with urine and bathing. I've seen people use it as eye drops. No, just stop all that nonsense. Urine is waste. It should be flushed in the toilet or, peed in a diaper, whatever. Don't use it for anything else. Don't drink it. Don't put it back on your body. Nothing like that. Just get rid of it. It's your waste. Okay? Stop listening to all this internet stuff. Except for this, of course. The urethra, let's go into the urethra. The urethra is a small tube lined with the mucous membrane. Remember, the lining is usually mucus because it helps reduce friction and it helps with lubrication. So the mucous membrane here in the urethra from the bladder's trigone, right? I'll write that word, Trigone, tri meaning three, trigone, and it shows this kind of triangular shape in the floor of the bladder, to the exterior of the body. That's what the urethra is for, is to get the urine out of the body. In females, the urethra lies directly behind that bone, the symphysis pubis, and is anterior to the vagina. In females, the urethra is very small. So in females, it's very short, I should say. It's about an inch. So I'll just put about 1.2 inches, the urethra is. And it's separate in females from the lower reproductive tract. In other words, it's separate from the vagina. And that's another thing I need to talk about. And we'll learn more about it when we get to reproduction. But I just want to emphasize here that the urethra is very anterior to the vagina, which is posterior to the urethra. And then the only other orifice we have in females is the anus. So beginning from the anterior, so from the front to the back, and the anterior to the posterior aspect of the body is the urethra, the vagina, and then the anus. Those are three orifices or three openings in women. So you do not urinate from the vagina. If you do, that's a problem. That's a fistula, usually seen in some countries where girls, literally girls, been married off and they get pregnant and their bodies aren't mature enough yet to push a baby through the birth canal, so they struggle, and then they rip and tear the vaginal and vaginal area, and it now becomes like a conduit to urine. So that is another topic, so getting those fistulas sewn up. Point is that there are three orifices or three separate openings in females, which many females that have taken this class did not know that. So I need you to know, you urinate from the urethra, not the vagina. If you are urinating from the vagina, that's a problem. All right? So it's separate from the lower reproductive tract, which is the vagina, which lies just behind the urethra. The vagina is behind the urethra. In males, however, the urethra passes through the center of the prostate gland immediately after leaving the bladder. So females, the urethra is very short. Another thing about that, in females having this really short urethra, it allows for ease of bacteria, especially something that can crawl like an E. coli to enter into the urethra and infect the bladder, called a cystitis or a urinary tract infection. If you don't take something such as an antibiotic to clear this up, the bacteria can ascend up the ureters into the kidney and cause a pyelonephritis, and that's scarring of the kidney. You have to be on like 3 different IV antibiotics, hospitalized, etc. So if you have a urinary tract infection, don't try that old, I'm going to just drink cranberry juice and all, because the real cranberry juice that you would have to drink that may work is not Welch's. It's not cranberry. It's some cranberry juice that you have to get from a health food store that is bitter as heck and it's very expensive. So you don't want to try that. Just get the antibiotic in this case and be done with it. Okay? And try to drink a lot of water and flush it out. But most people don't drink the water because they don't want to keep urinating. But drinking the water is always key. And also make sure that you wipe properly from anterior to posterior, from front to back. Teach your daughters, your nieces, your cousins, teach all your females how to wipe properly so that none of the fecal matter comes up towards this area. Especially in sexually active women, it's very easy to get a urinary tract infection. We call them UTIs. So this short urethra does allow for infection. Let's keep that clear. In males though, males' urethra passes through the center of the prostate gland immediately after leaving the bladder. So a male's urethra, I'm just exaggerate this here, and things like that. Oops. And I'm going to put here the prostate gland. Okay. I'm just going to put the urethra all the way down so that you'll know that's where the urine comes from the tip. Oh, and this is the penis here. So prostate gland here, urethra here, urethra is going, urethra here, and it's going all the way down to the tip of the penis. So in males, the urethra passes through the center of the prostate. Can you see the urethra is going straight through the middle of the prostate gland and immediately after leaving the bladder? And it ends at the urinary meatus here at the penis's tip. And that is where men use to void urine, right here at the penis's tip. It's usually about 7.9 inches. And, you know, that could just depend on some factors. I want you to know that the importance about this urethra going through the prostate gland is when the prostate gland, like a lot of glands, they change over time. And especially as you get older, this prostate gland will can hypertrophy. And as it gets bigger, whether it is benign or malignant, it can pinch on this urethra, and the male will just have dribbling. Like your bladder will be very full. He can feel that sensation, but can't pee, cannot urinate, because the prostate gland is pinching the urethra, so no urine is able to come out. So that happens usually as men get middle age and older. Glands do have a tendency to change. That can be called benign BPH, benign prostatic hypertrophy, or some people call it benign prostatic hyperplasia. Hyperplasia and hypertrophy are two different things, but I've heard it interchange. Hyperplasia is when you have a vast number of cells, so you have more cells than a normal. Hypertrophy is when you have bigger or larger cells than normal. So I've heard this used both ways, but the actual term, when I looked it up and checked, it was supposed to be benign prostatic hyperplasia, BPH, right? But malignancy will also cause that, but I'm just talking about something that's benign, not cancerous. So I want you to know there's two different systems to the having this urethra. So one urethra, one tube, serving two functions in the male: reproductive and urinary. So urine is prevented from mixing with semen during ejaculation by a reflex closure of the sphincter muscles guarding the bladder's opening. So here, there's a sphincter muscle here. When the penis is erect, this sphincter muscle shuts tight and does not allow urine to come through. So you're not having, when the person's having intercourse, you're not urinating and having sex at the same time. One thing at a time. Either you're going to have sex with the erect penis and no urine coming through, or you're going to urinate and hopefully in the toilet. I've heard other things. I won't talk about that, but you know, I've heard. So you want to do one thing or the other, right? Micturition, which is the last word here. Micturition. This means voiding of urine. Voiding urine begins with voluntary relaxation of the external sphincter muscles of the bladder. The detrusor muscles contract as a reflex, and they force urine out of the bladder. Force urine out of the bladder and through the urethra. This is a parasympathetic nerve fibers. Remember, parasympathetic, that's the only time you can really poop. When you're calm, right? It's calm. These nerve fibers permit contraction of the bladder, relaxation of the internal sphincter, voluntary contraction of the external sphincter, and that stops voiding. Micturition occurs voluntarily only if nerves supplying the bladder, only if you have nerves supplying the bladder. If there's some kind of accident where you're paralyzed, then you're going to have to be catheterized to get this urine out of the bladder. And you're going to have to do it on a schedule because you won't be able to have the sensation of feeling when this bladder is full. Usually you can have the sensation of time to empty your bladder on average at about 250 milliliters. You can feel that distension. You may not go to the bathroom like that, but that is a time when you can feel enough of the bladder getting larger that you're like, I probably need to go to the bathroom pretty soon. And, you know, this is what, you have to have a good nerve supply. If it's been cut due to an accident or trauma or anything like that, then you're going to have to just get yourself on a schedule to put the tube up to get the urine out through catheterization. So injury to any part of the nervous system or the spinal cord can cause incontinence, and that will be an involuntary emptying of the bladder, and no one wants to be just walking around letting urine leak out of there, right? So I think as far as, let me see, I think as far as the anatomy is concerned, that is pretty much everything with the anatomy. I think the next time we will start with the physiology of the urinary system, and if there's something that I missed in the anatomy, although that is all of it, I will just include it with that. We'll just now talk about in the next video for physiology of the urinary system. We'll introduce some things with the nephron.